Welcome to Working Smarter, Concise Compliance Conversations featuring Wendy Rubis, sponsored by Village MD, primary care physicians, practice medicine the way you've always wanted, data, resources, and clinical decision support to care for your patients inside and outside the exam room.
Hi, welcome to Working Smarter. I'm Wendy Rubis, General Counsel of Village MD. Today, we're talking about the new CMS transparency regulations, and I'm so lucky to be joined by Susan Zook. Susan is the founder of Mason Street Consulting. She's worked on the Hill for a long time, first with the Senate Finance Committee, and she's represented healthcare companies and helped making sure their interests are represented on the Hill. She's known the folks here at Village MD ever since going all the way back to the Affordable Care Act, and secretly, I call her my bestie. Welcome, Susan.
Hey, thank you very much, Wendy. So glad to be here, and thanks for having me on today.
It's such a pleasure to have you, and we just absolutely love anytime we get a chance to talk to you. You always help us understand so much about these rules, things that you can't get from the pages. But I can't help but ask before we get started, the question on everyone's mind is, what's the mood like in DC at the moment? Obviously, we're in some historic times.
Well, thanks, Wendy. I know a lot of people probably tuned in to watch the State of the Union this week, and I would definitely say that was one of the more sensational State of the Unions that I've seen in a long time. I think that as much as we want to put everything in one box or the other and say, oh, they're not getting along, they're not doing any work, they are getting along, everything's going great, it's really not like that. I think to somewhat parties are pandering a little bit to the media, to social media. That's just what they have to do. This is an election season, highly charged, a lot of politicking. But underneath it all, if we can just sort of get to what's happening day to day, there really is movement in Congress in a way that there hasn't been before. There's been a very aggressive moving administration that has a lot of things targeted, and I think a lot of people know that he come in ready and willing to move things that no one else has done before to get rid of the Washington swamp. And I think that's resonated on both sides with a lot of different people. And so I think both parties are really coming together to move things along. So
well, I think that's so good to hear, Susan, because, when you're watching this remotely, it seems so dire and like democracy might have been a failed experiment. So it's good to hear from your insider's lens that you see progress. And I will say, and we always say on Working Smarter, we believe that some of the people, especially in health policy and CMS especially, are brilliant. Seema Verna, always welcome on the podcast. We think some of these folks are the most brilliant, and the changes that they're doing as far as the Village MD perspective, we think is exactly right.
Well, and I think that just captures it perfectly. I think on the surface, you're seeing a lot of pandering, but underneath it, I think a lot of people know number one issue going into elections is healthcare. And they're definitely moving legislation and looking at different priorities through executive order and through regulation.
Well, and on that note, that's a good segue, because what we really plan to talk about today, not that we don't love hearing about how things are, but which is the real juice, let's be honest. But what we wanted to talk about today was we had a proclamation in June, which we call executive orders. People that are listening, the executive order itself doesn't have a lot of impact, but usually when we get an executive order, you see it expresses a priority to regulatory agencies, and then you see a lot of regulatory movement following that order. And so we saw in June an order for price transparency. We've all been hearing about price transparency. I've been working in healthcare for longer than I'd like to say. We've been talking about this. Everybody agrees it's important, but for lots of reasons, we haven't achieved it. So looking at this order, it's mainly healthcare providers and payers, and we're going to go into a little bit more detail, but it's basically making price information and making discount information available to consumers and the public. Is that the way you're thinking about it?
That's right.
So, Susan, why don't you give us a little background? What's underneath this? Why is this happening? I mean, you mentioned the upcoming election. Obviously, this is on the evening news every night, healthcare reform. But what's going on that's underneath this?
Sure. Well, so, when President Trump came into office, I think one of the deliverables he was talking about is getting away from the regular process of Congress and Washington and really go back and how's a business do it. And I think especially in the healthcare systems, a lot of consumers are confused and don't understand bills and the charges, especially around emergency services, things that are out of pocket, just not really clear in understanding how they make those choices. So there have been movement in the Senate and the House on issues surrounding emergency services with surprise billing legislation. I think the Trump administration's really talked and continues to talk very significantly about making things consumer friendly, giving consumers the power to make informed choices. Again, he has campaigned on what he calls a better business model. The government can be like a business and operate and make choices that are providing clarity to people who are making those choices. So I think this is just something that he's continued to talk about, and this is him putting words into reality.
Right. Thank you. So let's just go, because I think that's such helpful context, and it's hard to disagree that we need a better business model in healthcare. So let's go into some of the details about what this is, because in my view, I saw price transparency and I was kind of like, ho hum. I've seen so many different things about price transparency. This is actually an earthquake as written. I felt the ground shake under my feet when I read the actual proposal here. And if you're watching along, you can see kind of a summary. But as it relates to hospitals, the proposal is third-party negotiated rates would be reported publicly. And I think the process would be like annually. They would have to give an update to a database. That is such a sea change in terms of inside of one community. Payers may have an extremely discounted rate with one hospital. Another hospital might be making a lot more. It has a definite impact on healthcare in ways that the average consumer does not ever see or understand. So this would be a massive, massive change.
Yeah, and I think how the hospitals and the plans see it as well.
Yes. And then with health plans, I think the idea would be that they would have to disclose to beneficiaries more detail about the pricing. Of note, that does
Correct.
not apply. And I think, Susan, the health plan rules would not apply to Medicare Advantage.
Correct.
And I think you were kind of indicating, generally the feeling is,
right.
Don't fix it, not broke.
Yeah, right. I think everyone on both sides of the aisle, but especially, usually Republican administration like to point to Medicare Advantage sort of the solution in the Medicare program right now to really capping costs for seniors. There's catastrophic coverage, really provides extra benefits. I mean, the next stage we're going to is really providing extra savings to the government in that program. But I think at this point, everyone really agrees with a really great public-private partnership that's working really well.
Yes, got it. Good. Okay. So just a little bit more detail we'll kind of cover on what the payers are going to have to disclose. There's a bunch of different, quite a few actually, elements as far as what information they're going to have to give to beneficiaries. I'll just mention a few. It's the negotiated rate, the out-of-network allowed amount, items and services that are included. A lot of this they have to disclose now, but I think this would be much more onerous and a lot more detail. And frankly, it might be surprising to beneficiaries and upsetting.
Right. I think you're not the only one that feels that way.
Susan, what can you tell us about, obviously this administration has not been successful in court challenges in many of their other areas, even outside of healthcare. What are you hearing as far as, I know there's already been a challenge, the hospital groups have filed a challenge. What are you hearing about the opinion on the Hill about whether this is going to survive the challenges in the courts?
Well, I definitely think there's been other attempts by the Trump administration to do some really aggressive policies that just don't fit into legality. So I'm just going to give an example. Things I would think about would be in drug pricing. Trump administration wanted any pharma company that was running drug ads to also say the cost of the drug, and that was kicked out by the courts as being unconstitutional. So I think that you have a real case here, especially around proprietary information. It looks like it might just be stuck in the courts for a long time. It's just I think it's thousands of pages of regulations that have to go through a court proceeding. I think it'll be a while, but
I would be surprised if the terms of these private contracts would be mandated. I mean, it's just such a change. It's just such a paradigm shift in terms of even antitrust and so many different things. Right. So
I think really the underlying issue is that he just wants to get people on notice that it's not going to be the way that it used to be, where you just make these backroom deals, that people are confused and frustrated, and they're starting to voice their opinion with Congress and the administration, and they do feel like they're beholden to make it better.
Yeah.
And they're gonna.
Yeah. So one little detail that was sort of buried in here, which I think is interesting, is the medical loss ratio. And I noticed, and for our listeners, the medical loss ratio is something that came about with the Affordable Care Act. And it's basically a formula that describes the allowable profit in Medicare Advantage for payers. The idea being payers can't just continue to keep all the profit since it's a government program. So the profit is capped, and that cap is a medical loss ratio. Under these rules, it's proposed that there would be an exception. If they're doing certain value-based care work that is helpful, that there would be additional profit available for that. What are you hearing about? To me, that doesn't fit in with price transparency. That's like going the other direction.
I think that's right. There's another push to just get people on the right page, which is let's make sure that we're supplying the best value and the best quality in the system. So, if you don't want to be transparent, but yet you're showing us that you can provide a better product to consumers, okay, let's talk about that. I think that's really what they're saying here. It's a little conflicting, but it does get to the core issue, which is just making it better.
Susan, did I understand you to say there's other talk about this coming back up, like this isn't resolved? There may be other changes to the medical loss ratio.
CMS has been talking about making some changes, especially as they try to address issues with Part D, pharmacy rebates. There was discussion that they may put pharmacy rebates in the Part D program as administrative costs, which I know would really, I think, upset a lot of plans, especially, in the MA space. That would be really detrimental.
We could just sum this whole thing up to say, miles to go, to quote Robert Frost, miles to go before we sleep here. All of this is going to be shaking out. We're just proposed at this point. There's going to be a lot of shifting sands. We're just stopping on the woods on a snowy evening. I'm just quoting poetry, okay? Just a last note, as people that are fans of Working Smarter know, there's lots of processes here. There's a request for information now, which is just basically a way for the government and CMS to kind of go, we're aware there's some kinks here, so give us feedback. So that's going on now. We call that a request for information. There'll be a lot of changes to this before we get something final. But just to summarize, the change that we're seeing on the table right now would apply mostly to hospitals and also to payers. It would require all kinds of disclosure, including of private discounted rates. It doesn't disrupt Medicare Advantage too much, except for the profit sharing piece, and lots more changes will come before this is shaken out. Do you think we covered it all, Susan?
Right. I do. I wanted to mention the legislation that's been introduced as of recently as today in the surprise billing space from the Ways and Means Committee. That does indicate that there will be some physician reporting requirements as well. I just wanted to make mention that as potential piece of legislation that's going through Congress.
Is this what's the surprise billing kind of buzz?
Yeah, this is surprise billing. It just came out today, and they're supposed to have a markup, when they vote it out of committee next Wednesday.
Right.
So,
and I think, as you said, Susan, everybody agrees on price transparency, but it's complicated for physicians and providers in ways that I would be happy to explain to one of the senators if they needed me to. But I'm sure you're doing that for us.
Absolutely.
Well, Susan, I always feel smarter and actually quite younger and cuter when we talk because it feels so cool to kind of hear from you how things are going. I hope you'll come back and keep us updated on this.
Same to you, Wendy. Absolutely. I can't wait. It's been such a pleasure of working with you, Wendy, and the whole Village MD team.
Yes. Thank you so much. And we'll talk again soon. In the meantime, if anything comes up, give us a call.
Will do.
Thank you to our sponsor, Village MD. We hope you will join us for future concise compliance conversations.